What's up, guys? Mike Parker here at the Center for OCD and Anxiety in Pittsburgh, PA, and this is OCD Space, where we talk about all things OCD. Now, today I want to talk to you all about the concept of relevant and how you can figure out whether something that's on your mind or something you're worried about is actually a relevant concern or not. A really hard question to answer sometimes when you've got OCD, but we're going to figure that out today. All right, guys, if you've been liking these videos and if you like this video, please be sure to hit that like button below and please consider subscribing to our channel. That really helps us get all these videos out to more and more people. And with that out of the way, guys, let's get started. Alright guys, happy to be back. Let's talk today about the topic of relevant and how you actually decide whether a concern you're having is a relevant concern or not. And it's hopefully going to be a short video because the answer to how you do that is quite simple. The way that you actually identify, and the only way you can ever identify whether something is relevant to you or not, is to base your focus on direct sensory information in the present moment. And so what this means is that a concern is relevant to you when you're getting direct evidence right now with your senses and you have information telling you irrefutably this is something that is happening, this is something you need to address. That would be the only way to identify this as something that's relevant. Now, if you're not getting that information, if you are worried, if you're thinking about possibilities, if you're thinking about what ifs, and not getting the sensory information, that would be a sign that the concern is not relevant to you. Now, that can be really hard to do when you got OCD, because when you've got OCD, the problem is you stop trusting your senses, and you stop trusting yourself, you stop trusting information, and you keep doubting all of that stuff in the area where you are concerned, in the area of your obsession. And so what that means is the very thing you need to identify something as relevant is something you are not utilizing and something you're not trusting. The only way out of worrying about things that are irrelevant and not happening is to trust your senses and trust what you know right now in the here and now. And so that's the key to learning to turn things around with your OCD, is actually learning to utilize those senses and trust your senses again, and trust information that you have, and ultimately trust yourself. So if you were to think about a specific kind of obsession, let's just say, hit and run OCD, this is something most people with OCD will encounter at some point. It's a very common concern. So you're driving, and maybe midway between your drive, you start to think, hey, there were some bumps that I hit along this drive I'm taking. What if one of those was actually a person? I hit them, I didn't even see them, and now I just drove away from a crime I committed, and there's a serious situation where someone's hurt or dead. This is a what if that you suddenly start to explore, and the mere scariness of it is making you feel like you need to think about this, feel like you need to pay attention to this, feel like you need to explore it, and maybe even drive back and make sure it didn't happen. Or call someone, which is another common thing someone might do. Do you think one of those bumps I hit could have been a person? No, of course not, dear. So the fact that it's so scary and so disturbing makes it seem like, you should pay attention. However, notice the person in that situation has zero direct evidence that a hit and run scenario is a relevant concern, right? The most you can say is, I hit some bumps, and when you hit bumps and you hit potholes, the most relevant concern there is, I hope my tire's okay, right? That would be the relevant concern from hitting a pothole. Now, jumping from a bump must be a person, that's taking a leap in your imagination. That's doubting what you actually know and exploring possibilities, because what you really know is life is very quiet. There's not a police car chasing me. There aren't people driving after me yelling and telling me to turn around. I hit someone. There wasn't a body. There wasn't anything, right? And so trusting information would be trusting the lack of anything going on. And that's what you have to start to do when you have OCD, to really turn the tables on OCD. So I guess this is pretty straightforward, right? Using direct evidence as your guide. But the tricky thing that you might encounter, and I'm going to add a little more to this video, is just be careful to not read into real life events, right? There's going to be real things that happen, and then if you read into it, it suddenly seems like evidence of a concern. A very common example would be a headache, right? If you've got a headache, the direct sensory information you have is you have a headache. And that doesn't mean you have a brain tumor or whatever OCD wants to tell you is going on here, or make you worry about, or whatever those possibilities are that you start to think, perhaps. The only thing you have is a headache, which means the only relevant concern you have is, how do I get through my day with this annoying headache? Now, let's just say you have headaches that go on and on and on. Sure, that sounds like something to tell your doctor. And then, after you see the doctor, then trusting your senses is about trusting what the doctor has told you and incorporating that into your knowledge and trusting that information. And so, that's how you have to be careful not to read into things. A headache's just a headache. Another area where people get confused is with sexual obsessions. You start to worry, what's my sexual orientation? You start thinking about this constantly, trying to figure it out. Or, a sexual obsession can take a darker turn. You start to wonder, am I attracted to something that indicates I'm some sort of deviant or dark individual? You start to suddenly pay attention to what's going on down below in the organs down there, what's getting me aroused, what's not. And so you have to be careful not to read into arousal, right? That's just a bodily response to life, and anything could really make that arousal response happen. And so you don't want to read into that. It is just what it is. At face value, arousal occurred. I don't have to use that as evidence to figure out what I desire, what my preferences are, anything like that. Those things just come from trusting yourself and having self-knowledge. They don't come from paying attention to what's causing me arousal. That's a path you don't want to go down, because then you can even get into a psychosomatic situation where you've sort of conditioned yourself now. Every time I have this thought, it happens down there just because I'm so worried and nervous about it, right? That's a typical thing that your body can mess with you about. So careful, don't read into bodily responses and take them at face value. They are what they are. That's it. They are not an indicator of something more. So, hope this has been helpful, guys. Good luck getting out there, trusting your senses again, turning the tides on OCD, and starting to demand more from life, before you worry. Demand more direct evidence. And then if you don't have that direct evidence, if life is quiet, realizing you have no relevant possibilities or what ifs that you need to explore right now. You can trust the silence of life. You can trust the quietness of life. You can trust that nothing is actually happening that I need to worry myself with right now. Okay, guys, hope this is helpful again. And until next time, be sure to trust yourselves and take care. Bye.